Unlike the rest of the U.S., San Diego is not seeing that massive surge in flu cases known as the super flu just yet.
And the county has this new tool to track illnesses in San Diego. Joining us now to explain is Dr. Mark Beatty, Assistant Medical Director with the county. Doctor, good morning, and thank you for being here. I feel like everybody's getting sick, though, around here, no?
Yeah, but it's interesting what's going on in San Diego with the numbers being less than what we're seeing in the rest of the country.
Okay.
Even San Francisco is having large cases of flu.
Talk a little bit about this variant, because we have the flu, but this is something different?
Yeah, it's called the K subclade. It's just a fancy name for a variant of the flu. And it's unexpectedly more different than what's in the vaccine to cover for that. And that's why it's allowing, or could allow, for more cases of people getting that strain of flu worse.
Why is it spreading so fast?
It's largely because the match with the vaccine isn't as good.
It's as simple as that.
Yes.
But there have been other variants in the past that don't match a vaccine, but we haven't seen the spread at these levels.
Yeah, it's because it's significantly more different than what would have been expected.
Wow.
So that flu shot, let's say there are people who are watching right now that didn't get the flu shot for this season. Is there even a point to get it at this point?
Absolutely. So we can't predict what's going to happen next week or the week after. And so we could see a surge that it's just delayed for some reason. So that's very possible. Also, even though that flu strain in the vaccine isn't the best match, it's providing some protection. And then there are two other components that are good matches and it certainly could protect against those.
Tell us about this new infectious disease surveillance system. It sounds like pretty fancy. It's a surveillance system. How does that work?
So we are now taking in-house wastewater testing for various viruses that include flu, COVID, even hepatitis A and other things. And it's a fantastic system because with the increase in home testing for things like COVID and flu, we don't have the strength of numbers as we used to when all those tests were done in laboratories. And so now we could test basically a third of the county's population through testing the wastewater. The other benefit is that people usually shed pathogens before they start to get symptoms. So it could tell us what's happening 1 to 2 weeks into the future so that we could warn the providers, hospitals, and the community about what's going on.
That's amazing.
Yes, it's a really great system. We're very happy.
With the data that you're able to collect, how does the public get access to that? And is it easy for them to be able to read? Or
we just went live with a website that tells you what the current available data, and it's been made very easy to read with arrows showing the trends up or down.
I was going to ask, usually those things are very difficult to read. But there are I like the arrows because it tells you kind of what to look at and what it means.
Yes. And they're also color-coded, so that helps too.
I love it. If there's a large outbreak of a dangerous virus, how does the county work to kind of release the alert to the community? We saw similar things when, 5 years ago during COVID, but how do you guys plan on doing something like that if it gets to that level? Yeah,
we have a great infrastructure to send out health alerts to providers, in mass amounts through emails and other ways. And then we also reach out to the community through social media and news center stories, and then even working with you all to get the information out there.
Well, Dr. Mark Beatty, we appreciate your time and all this information. Hopefully, we'll get through this season and get out of it soon.
Stay safe.
Stay safe. All right, well, we'll be right back.